So in our study, we are interested in three distinct pathways through which we think COVID-19 might have an impact on mental health. The first one is the obvious one, which is the social and physical isolation, loss of contact with family and friends, less social interaction, and increased loneliness and anxiety, and so on. The second pathway is that we investigate is the economic insecurity. So that might be reduced labor supply, reduced income, or increased stress due to financial constraints or economic uncertainty, and so on. And the third pathway through which we think that COVID-19 might have an impact on mental health is inter-household conflict. So this is increased likelihood of inter-household disputes and physical or psychological abuse and increased marital problems and things like that. And these three channels obviously might interact with each other. So to give you a stark example, in early 2019, the share of the US population who reported having symptoms of anxiety or depression was around 11%, and by April 2020, this was up to 45%. And the recent study estimates that treating these illnesses or these symptoms just for 1 year will end up costing $1.6 trillion to the healthcare system. So it looks like the COVID-19 had huge implications on mental health, and that's what we're trying to estimate. And another motivation for us to do this study is that we know that in the future these costs, mental health costs, will be a defining feature of the policy decisions with respect to the response to the new waves of COVID-19. So more specifically, we are trying to quantify the impact of stay-at-home orders on mental health. We will use Turkey as a country study because the Turkish government imposed a very strict lockdown on population age 65 and older in mid-March, pretty early in the pandemic. The non-compliance was severely punished through financial penalties, so it was well implemented and compliance was high. We know that from anecdotal evidence, and also it remained in effect all the way up to in June 2020, which makes it one of the longest confinement policies to reduce COVID-19 related mortality in anywhere in the world. So we use this age 65 binding age cutoff as a natural experiment where you have individuals who are just above 65 and who had to stay at home for more than 2 months, and you have individuals who are a little bit younger than 65 and they were not bound by the curfew policy at all. So it gives us a nice natural experiment where you have two groups of people in either side of the threshold that are actually quite comparable. So if you were to conduct a survey, and which is exactly what we did, that assess the mental health of these individuals, the differences that you observe should be related to COVID-19 lockdowns. And I think that's what makes this study interesting, because we can say something in a causal framework about how confinement, physical and social confinement, impact the mental health of individuals. So we went on the field when the curfew was happening, before the lockdowns were over. We collected data through phone surveys. We asked individuals a set of questions that measure their mental health, and these individuals were between age 60 and age 70, so we kind of restricted the sample to the age group that we're interested in, with 65 being right in the middle, to gain power from the sample and have more precise estimates for the statistical analysis. So what are the findings? Well, we have three main findings in the study. The first one is we showed that the curfew was highly effective in reducing the physical mobility of individuals who were 65 and older. It decreased the number of days that they spent outside their home, and it substantially increased that they entirely spent their entire time at home. Unfortunately, we show increases in symptoms of anxiety and depression. We asked questions both on somatic and non-somatic anxiety and depression symptoms. So we asked, the general questions about their state of mental health, but we also asked questions about their eating behavior, whether they have digestive problems and things like that that we do not immediately associate with deprived mental health. When we look at the pathways that I described before, what really causes these changes in mental health is physical and social isolation. So individuals lost contact with their family, at least reduced contact with their family, reduced contact with their social environment. We showed that their physical mobility has substantially reduced, while we do not observe significant changes in either domestic disputes or economic insecurity, at least differentially for the population aged 65 and older.